Hello, I'm Dr. Gayathri Kamath, the consultant obstetrician and gynecologist at Fortis Hospital, Bangalore. I'm here to address fears and concerns addressing pregnant women regarding coronavirus pandemic. Now, at Fortis, there has been a constant endeavor to ensure evidence-based care is given to all. Our healthcare workers are working tirelessly to ensure safe motherhood to all our pregnant women. Our infection control team has been constantly working to ensure all healthcare workers are safe and healthy to take care of our pregnant women. The segregation and triaging of infected and non-infected patients are well streamlined to ensure that any patient stepping to the hospital is safe. The physiological changes of pregnancy and the immunosuppression make pregnant women more susceptible to infection. There is good news to pregnant women as well. Over 2/3 of pregnant women who contract COVID infection recover completely with either mild or no symptoms whatsoever. Besides, pregnant women are no more at risk when compared to non-pregnant women in terms of contracting the COVID infection. There are very few pregnant women who get critically ill with COVID, and they are generally in the third trimester after the 28th week of pregnancy. These are some of the reasons why pregnancy is considered to be a vulnerable group, and hence it's all the more essential that pregnant women exercise all precautions to prevent contracting the coronavirus infection. And hence, it's essential they practice social distancing, hand hygiene measures, and usage of masks all the time. Now, despite the ongoing pandemic, there is an urgency for all pregnant women to have a sense of normalcy in their day-to-day activities. It's important they have a well-balanced diet, they hydrate themselves with enough fluids, and have exercise on a daily basis. Staying connected with people and venting out fears is very important to maintain mental sanity during these trying times of the pandemic. A word of caution with social media: over usage or overwhelming information from these can be counterproductive, and hence they need to decide when to stop indulging in too much of digital platforms. Antenatal checkups are preferably done on online platforms, either by video consultations or teleconsultations, especially when the cases are on the rise. It is imperative that essential scans and blood tests are done as much as permissible. Now, if a pregnant woman contracts corona infection during pregnancy, it's important she touches base with her obstetrician online, and she is going to then be guided regarding what care she needs to take, what precautions she needs to exercise, and the red flag signs for which she needs to report to the hospital immediately. Every pregnant woman contracting COVID infection is going to be worried about if the baby is going to be infected with the virus or not. Thankfully, vertical transmission from mother to baby is very uncommon. There is also a fear of miscarriages and fetal abnormalities in women contracting COVID infection during pregnancy, but there is no data to back up on this. Yes, data does prove that there's a slightly higher chance of preterm births and low birth weight babies in women who have contracted COVID infection during pregnancy. So, if a woman contracts COVID infection during labor, she can breastfeed her baby. And as per CDC guidelines, it's important she uses mask while feeding, and distancing of the mother and child while resting in the room is essential, and consideration of breast pumps is also recommended in such situations. So, all the pregnant women out there, stay safe, remain positive, and have a positive outlook. Every dark cloud has a silver lining. So this storm too will pass, and we shall all sail through these waves of pandemic soon. All the very best, and I wish you all a safe and pleasant delivery. Thank you.